diagnostics, as well as laying out the options, what can be done so it can inform more effective investment in the health area. And that needs to be done. We are in the bank dedicated a lot of resources on the knowledge agenda here. Secondly, about financing, because you want to scale up investment in climate resilient health investments. And that needs to be scaled up. The bank actually has been increasing enormously our investment since 2020. Just to give you, say, only in the health area, it was about $28 billion, $7 billion on average, and in total about, in the last for about $2.2 billion in specifically health-related components on this. Clearly, that has to increase. We have been increasing, if you that compared before the COVID time, actually we have tripled these investments in climate-related health in there. But clearly it needs to be done more. You may have heard that Ajay Banga, the president of the bank, said we need to go to the next stage. We are around 40% in total financing of what the bank wants to do in climate. We want to go next fiscal year to 45%. And that will also be reflected in increased ambition in the health area. Now, that is very good. But what we need to keep in mind is the bank can do a lot, but in the end of the day, it is only the additionality that counts. Because if we do a bit more and somebody does less, who is kidding who? What we need to do is to test that domestic investment have to go up and then the international investment, including of the multilateral development banks. We're working with the Asian development with the other banks together. So what matters is then ultimately how these partnerships are working out. I think that is where we have had a complete new operational partnership, for example, with the WHO, particularly in pandemic relief. And that is, I'd say, that's the way to go. So basically what we need to do with financing with the other banks, but also other interested groups, and push that envelope. Because the test is, how can you constrain the fact that basically extreme poverty is increasing, and that is devastating for any development institution. Ultimately, we are sitting here in front of failure. And if we want to avoid that failure, we have to invest, we have to unite, and to act now.
Thank you, sir. We applaud the ambition. Absolutely. Minister Nisia, the floor is yours. Brazil has been a long-time global public health leader, and Brazil will soon be in the unique position, of course, of steering the G20 presidency in 2024 and COP28 in 2025. Minister Nisia, could you tell us about your plans to advance this climate and health agenda and confirm that in 2025 you will very specifically ensure that health and climate are at the heart of those talks?
Well, first, thank you very much for the invitation. As Minister of Health of Brazil and part of the global health community, I feel a very deep feeling of hope, and I hope that you can work together with so many partners to go ahead in this agenda. Today is not a single day, but a process, and I think that is very important for us. Thank you very much. In terms of the Brazil agenda, and the first point is that climate change does not affect everyone equally. So this kind of perspective to look for justice in terms of the agenda of climate change and health will orient our work in G20 and COP30. We think that it's time to put together these themes and to address the fundamental issues that lie behind the climate health nexus. It's a fundamental challenge to implement sustainable development goals, to whose achievement we remain really committed in our country. It's important to mention that our focus in the agenda for G20 is part of a strategy presented yesterday by President Lula here in COP, that is to work in the mitigation and adaptation plan, and for health is so fundamental as we can see, but at the same time to work for the transformation and to think about the plan for ecological transition. As the Dr. Tedros mentioned and many Ministers of Health here, climate change contributes to the proliferation of disease-carrying vectors like dengue, Zika, chikungunya, and the increase of resurgence of other water and vector-borne diseases in urban areas. We know this. So the challenge is how to increase demand for healthcare, surveillance, health promotion services. That data and intelligence activities are fundamental, but at the same time, resilient health systems. So I think that this kind of perspective and goals have to be in the center of the agenda for G20 and COP30. Another point important, I think that collaboration has advanced in our sub-region. I mentioned especially Mercosur Ministers of Health during the Brazilian pro tempore president. We have moved forward the development of an operative plan to implement this strategy on climate health. So I think that this contribution, besides Asian, African, and other European, of course, can be together in our agenda G20. Brazil hopes to contribute in this agenda. Climate health and climate change and health is one of the priorities of the agenda proposed by Brazil, and I hope that you could increase in this perspective, besides resilient health systems and the equity as a very key component of this agenda. Building resilience and adapting to current and future threats need secure funds, and in this perspective, this session, this panel here, has a very important role. At the national level and at the international level, besides working with the other sectors, it's necessary to wake the power of community engagement at all levels of the decision-making process. I think that no solution can be implemented without guaranteeing the full participation of civil society. And this point will be very concerning in our work in G20 and COP30. Yesterday, we have a meeting with the Brazilian civil society here represented, and I think we have to enlarge this perspective in a global level. The challenge is huge, in my perspective. Future-proof solutions are not a matter of choice, but is a need for survival. So we have to work together as global health community for this reason, for these goals. Thank you very much.
Thank you. I thank you all for keeping to time, because that's also useful. But I hope you all feel that you had adequate time to really, provide some perspective for the audience here and for those watching around the world. I applaud you. Thank you very much, and I will let you go. And as my panellists leave the floor, thank you very much indeed. And before moving on to our next segment, I'd like to turn over to the voice of the healthcare community, who are, of course, at the front lines of the climate health crisis.
The climate change has affected my community. Des inondations liées à des précipitations comme jamais vues.
It caused damage to infrastructural, the hospital and other households.
During the dry spells where there is no food, even mothers who are breastfeeding do not get enough food in order to get enough milk.
Les cas de malnutrition liés à l'insuffisance alimentaire.
These diseases coming, malaria, skin infestations, typhoid diseases, and even mental health, because people are anxious. I work as a community pharmacist.
A public health nurse.
Yes, climate change is extreme. It's our role to do what is right.
Well, for our next conversation today, we're going to pivot to one of the overarching themes of the COP28 presidency's consultations this year, the health co-benefits of mitigation. The causes of climate change, namely the burning of fossil fuels, overwhelmingly overlap with the causes of harmful and fatal air pollution. And we've heard that underscored again and again this morning, as Dr. Maha and Dr. Tedros pointed out in our opening. Mitigation and the just energy transition are perhaps the biggest climate contribution that we can make to human health. So to help us unpack the opportunity and these specific policies, finance and tech to realise that, I'm pleased to invite to the stage two distinguished guests joining us today. Mr. Fatih Birol is the Executive Director of the International Energy Agency. Fatih, please join me on the stage. And Special Presidential Envoy on Climate for the United States, John Kerry. Round of applause, please. Come and join me. The choice is yours. Fatih? Oh, go, John. Yes. Oh, you? Look. Brilliant. Thank you. Fatih, let me start with you as Executive Director of the International Energy Agency. You've made it a focus to accelerate a just energy transition and ensure energy security for all and reach global climate goals. And that is, that's a big portfolio. Tell us why the energy transition is foundational to good health.
Okay, thank you very much. It's a great honor to be together with Secretary Kerry here. So we have seen that the fossil fuels, decades and decades, in fact, we should be honest, they help to lift millions of people out of poverty because they, fossil fuels make our economies more efficient, our lives more comfortable. As such, they played a positive role in the past. But, and there's a big but here, fossil fuels also create serious health implications. I wanted to mention to you one of them, which is the air pollution, which is a big problem in many emerging countries, especially using coal through particulate matters, a big reason for lung diseases. So it's a major issue. And the Western world has solved this problem, and it is, in my view, a moral responsibility. They support the developing countries to solve this problem as well, because it is a very easy, technically very easy thing to solve, and from a financial point of view, not a big problem at all. So we have all the clean energy options today at our disposal, ready and cost-effective in the entire world. We just need this to happen in the emerging and developing world.
Thank you, Fatih. Secretary Kerry, you've been a long-time advocate of 1.5 degrees and a much greater climate ambition, and you and I have talked about this long and hard. How is human health influencing American and global goals on mitigation, and what have you seen as the most effective ways to make the health case for the energy transition?
Well, I think that the reality, the absolute reality of the fact that our bodies are ecosystems, and the world is an ecosystem, and everything has an impact on everything. If you poison our land, and you poison our water, and you poison our air, you poison our bodies. It's astonishing to me that it has taken as long as it has to have health be centerpiece part of the climate discussion, because the reality is that it's killing people around the planet. 8 million people a year die of bad air quality. And not bad air quality, methane and coal pollution. There's a study that just came out the other day. My daughter, Vanessa, who has the privilege of working with Dr. Tedros, repeats to me frequently that we should not measure progress on the climate crisis just by the degrees averted, but by the lives saved. And the fact is that there's a new study by George Mason and by the Chan School at Harvard, which underscores that coal is, in fact, doubles the number of deaths over the other sources of air-carried pollution. And coal is about PM 2.5. When you measure the PM 2.5, it's double for coal. Now, we don't need that necessarily to tell us we ought to be transitioning out of coal. There shouldn't be any more coal-fired power plants permitted anywhere in the world. That's how you can do something for health. And the reality is that we're not doing it. So, you know, the measure here is really sounding the alarm bell. I find myself getting more and more militant because I do not understand how adults who are in position of responsibility can be avoiding responsibility for taking away those things that are killing people on a daily basis. And the reality is that the climate crisis and the health crisis are one and the same, totally connected, totally converging at this moment in time. So in the United States, during the summer, the largest cause of children being hospitalized to the cost of about $55 billion a year minimum is environmentally induced asthma. That's the quality of air. And so how do we change it? We start doing the realistic. We want to save lives, and if we want to have healthcare systems that are not overburdened with people who have a new cancer or a disease, which we thought we'd eradicated. You heard Bill Gates earlier and a couple of speakers. We are seeing climate crisis bring back malaria because it's warmer and more moist in certain places. That moisture is also contributing to the increased power of our storms that do damage in our communities, to the increased level of rain, which is flooding people. 30 million people in Pakistan moved in one event. So I think it is very clear, you know, the Hippocratic oath for doctors is do no harm. And we're doing the most harm we could do to the very patients that we then turn to the doctors and ask them to cure. That's the definition of insanity. So we need get our jobs going, doing the mitigation we need to do. We have sources of energy that are clean. They may, some of them, be temporary, but they're clean. And they are certainly better than opening up a new, the dirtiest fuel in the world is coal. And we should stop killing ourselves using that coal. And that would do more to help health and change the flow of the carbon crisis. It would join us together on a similar path and be one of the most salutary things we could do, Becky.
Thank you. And thank you both. I'm going to let you go. I'm going to carry on with the panellists today, the further panellists I have. But, Fatih, please, we do have a minute.
Just one point. When we talk about the energy and the health, there is one issue, which is the fact that, especially in Africa, 4 out of 5 families use primitive cook stoves for cooking a meal, especially women. And the indoor pollution as a result of using wood, agricultural waste, animal waste is one of the 2 major reasons for premature death for women in Africa. We need to fix this problem. It is only $4 billion per year, and it is a very small money when you compare what we are doing. And the International Energy Agency, Mr. Secretary, is organizing a major international conference next year in Paris in order to find a solution for once and forever to solve this problem, to address this problem.
Thank you. And Vanessa's words are ringing through my head now. I think those are sage and wise words when we begin to pivot into reminding us.
She's very sorry not to be here. She was supposed to be here, but she had surgery on her knee.
Right. So. Well, we bless her, and she's been introduced, but just through her wise words. Thank you. Thank you both. Well, delivering on climate mitigation is the challenge in front of us to also deliver on health, of course. Thank you both for your leadership and vision. We'll talk with us now about how countries and communities are working towards this health-forward energy transition. And I repeat that, this health-forward energy transition. I'd like to welcome to the stage now our next panellists. Sweta Narayan is a climate campaigner from Healthcare Without Harm. Please come and join me on the stage. Jane Burston is the CEO of the Clean Air Fund. Jane, where are you? Come and join us. Julia Gillard, very familiar face to so many people here in the audience, Chair of Welcome, and the Right Honourable Andrew Mitchell, Minister of State in the UK, Foreign, Commonwealth and Development Office. Right. All right, come and sit down. And I've introduced you this way, and I'm going to start at the end and pick up with Andrew Mitchell. And thank you all very much indeed for joining us. Minister Mitchell, tell us about how the UK's leadership on climate change is embedding human health in your approach to climate action.
Thank you very much indeed, Your Highness, Your Excellencies and distinguished guests. I'm very grateful to His Highness and the UAE for bringing us together on this particular subject. And as Dr. Tedros put it so very well, the climate crisis is a health crisis. Indeed, the WHO views it as the biggest health threat facing humanity. Could there be a clearer, more powerful call to arms, as John Kerry so brilliantly put it? Are any of us prepared to see the hard-fought progress we've made on development over the last 5 decades reversed? I saw recently in Mozambique, where I was with the head of the Global Fund, which Britain has added £1 billion to in the last year, the effect of the floods, the growth in mosquito larvae and the 50% reduction in malaria, which had been achieved in Mozambique, now for the first time for many years reversing. And that is why the UK led a health programme at COP26, along with its partners, and it is why we pioneered the Alliance for Transformative Action on Climate and Health. The Alliance now spans 76 countries, plus many partner agencies, many of whom are here with us today, all supporting each other as we strive towards climate-resilient, low-carbon health systems. And the Declaration on Climate and Health, sponsored by the UAE, powerfully sets out why the international community must come together. The UK signed up to that declaration because it marks an important milestone. We have long been a top donor on global health, spending more than £1 billion each year around the world. And I'm now pleased to announce that new UK funding to tackle the devastating threat that climate change poses to well-being around the world. This includes, firstly, up to £20 million for a new programme to support climate-resilient and sustainable health systems, including funding the Alliance for Transformative Action and helping partner countries to mobilise investments. Britain is the first G7 country to have a specific climate health programme of this sort. A further £20 million for a research programme which draws on British expertise and evidence, and in collaboration with our country partners, this will guide our future work spanning climate and health. Increased funding for UNICEF to help deliver climate-resilient water, sanitation and hygiene services in the DRC, Sierra Leone and Pakistan, and to unlock finance. In addition to this, I can announce today that 20% of the £80 million the UK pledged to the Global Financing Facility in October will be spent on climate and health. Our determination to address the devastating impact of climate change on global well-being will not waver. The collective will demonstrated today fills me with hope that together we can make progress. And although I'm extremely sorry I have to depart very shortly for another meeting, my friend and colleague Andrew Stevenson, who is the British Minister of Health, will talk about steps being taken in the UK on this vital area of work. Thank you very much indeed.
Thank you. And with that, you're more than welcome. You've made your apologies, so if you do need to leave the stage, please do. But thank you very much indeed. Super. Good. Okay. Some decent lines there. Shweta, you work in communities in India where air pollution is a significant cause of mortality, and your organisation, Healthcare Without Harm, is a leading voice, both calling to end the fossil fuel use to protect human health and decarbonise the health sector as a whole. And I think we haven't perhaps talked as much about that as we might do today. Why is the energy transition so critical for health and healthcare? And what solutions does the global economy need to take forward to realise these health gains?
Thank you. I would like to start with mentioning that this year has been yet another sobering reminder that the climate crisis is not a distant possibility. It's a present reality. We live it, breathe it, and wrestle with its consequences daily. Our civilization's dependence on fossil fuels drives the climate crisis and therefore is the greatest threat to human health today. Our bodies, communities, and ecosystems bear the scars of a planet pushed to its limits. We're paying the price of our society's addiction to fossil fuels with our health. In 2020, during the pandemic, the total fossil fuel subsidies amounted to almost $6 trillion US, and while the combined spending of all governments on health was $9 trillion. Healthcare professionals around the world are witnessing firsthand the human health impacts of climate crisis. Our nurses, doctors, and frontline health workers are the first responders to this crisis. Now, we cannot adapt our way out of a 2-degree or a 3-degree global temperature increase. So our solutions must focus on prevention and addressing the root cause. And our approach should move beyond treating just the direct health consequences to demanding both political action and accelerated finance for a fossil fuel-free future. And we can only be successful in tackling the climate crisis when we join forces with other sectors in the society and address the root cause. We, as a health sector, can be a powerful catalyst in the just transition. And that's why I'm heartened that last month, health leaders representing more than 46 million health professionals called on the COP28 presidency and the world governments to commit to a rapid, just, and equitable transition away from fossil fuels towards clean, accessible, renewable, healthy energy. And when we are thinking about transitioning to a low-carbon economy, we must ensure that the socially and economically unjust patterns of a fossil fuel economy are ended and not repeated. And health cannot be a mere co-benefit of a just transition. It should be the driving force. Now, let's also remember that healthcare sits at the epicenter of our collective climate trauma. And the uncomfortable truth today is that the health sector itself is contributing to the climate crisis by its own greenhouse gas emissions. Now, many health systems, public and private, around the world are taking action to shift towards low-carbon, climate-resilient, sustainable health systems. In order to align the health sector with the commitments of Paris Agreement, we must accelerate the health sector decarbonization in high-emitter countries and invest in low-carbon, climate-resilient health systems in low-emitter countries, with all of health sector reaching net zero by 2050 at the latest. Finally, I think I would say that this is the moment of transformative leadership and bold decisions. And this brand of leadership requires sacrifices, not of people and communities. We need the willingness to forego profits and shifting of societies that treat our people, animal, and planets as expendables to valuing health. I would like to end with the fact that the essence of the Hippocratic Oath of first do no harm is calling upon us to take on this climate crisis in this moment now, because later is too late. So let us not view health as a casualty of climate change, but as its compass, guiding us with just and equitable solutions into a fossil fuel-free world where no one is left behind. Thank you.
Shweta, thank you. Jane, you were nodding enthusiastically and sagely to Shweta's words there. You, of course, lead the Clean Air Fund, whose mission is to tackle global air pollution. What's your perspective on the highest impact climate interventions for health, and how are they most effectively financed?
I think that most people know that air pollution is awful for our health. If they didn't and they've been listening to this panel, then they should now. Dr. Tedros, John Kerry, many of the panelists have mentioned that the statistics that came out at the beginning of this week, that 8 million people now are dying every year from air pollution, and 5 million of those from outdoor air pollution caused by fossil fuels. 500,000 of those deaths are babies and children, and I think it's easy when we hear these statistics to let them wash over us. You know, they're big, big numbers, but you know, we listen to them and then we forget. But the people that don't forget are the families who are absolutely devastated by the quality of life of their loved ones deteriorating and ultimately their death. Families like the family of Ella Kissy Deborah, who's a little girl who lived in London. She died aged 9 from a very severe asthma attack that was brought on by traffic pollution by her house. And she's the first person in the world to have air pollution written as the cause of death on her death certificate. So her mum, Rosamond, is campaigning so that that doesn't happen to any other families. But unfortunately, outdoor air pollution is on the rise, as are the deaths from it. And if we don't do something, premature deaths from outdoor air pollution are due to more than double by 2050. But there is some good news for our Sunday morning. 3 pieces of good news that I wanted to share with you, in fact. The first one is that action on air pollution is very often action on climate change. And that's because of the 2/3 of air pollution that's caused by fossil fuel burning. So if the causes are the same, the solutions can also be the same. As Shweta mentioned, renewable energy, clean industry, more walking and cycling, electric public transport. Second piece of good news, the benefits from reducing air pollution come really quickly for health and climate. So on the health side, we've seen experiments like natural experiments around the Olympics, for example. In Atlanta in the 90s, some of the transport measures that were undertaken to reduce pollution meant that children with asthma were showing up at clinics 40% less. In Beijing more recently, it was 58% fewer asthma attacks because of the air pollution measures that they took during the Olympics. And that happens almost overnight. On climate change, some pollutants that are bad for our health are also bad for the climate. That's the same thing. So things like black carbon or soot, it has an incredibly high global warming potential. And if you reduce it, because it only lasts in the atmosphere for a few days, it almost immediately disappears. So it can't land on snow and ice, it can't accelerate the melting, causing water security issues and flooding. And the third piece of good news is that in economic terms, action on air pollution will actually save us money. The OECD and the World Bank tell us it will save us trillions. And so you were asking what do we think should be done about it and what specifically is the Clean Air Fund going to do over the next year. And I wanted to highlight three things. The first is that today we are very pleased to unveil a new commission that we've set up with our partners, the Council on Energy, Environment and Water. It's co-chaired by the Right Honourable Helen Clark, former Prime Minister of New Zealand, and Dr. Soumya Swaminathan, who was the former Chief Scientist at the World Health Organization. And it aims to address the political barriers to committing to and implementing actions on air quality. It will strengthen the economic case, secure additional financing, scale up solutions and track progress. Second thing of three is Breathe Cities, a partnership with Bloomberg and C40 Cities and the Clean Air Fund, which is putting $30 million towards 11 cities announced yesterday to support them to reduce their air pollution by 30% by 2030. And together they're going to reduce greenhouse gas emissions by carbon dioxide equivalent of 280 megatons and save 40,000 lives and 80,000 childhood asthma cases in the next decade. And then thirdly, you mentioned financing. We're very pleased to endorse the climate and health finance principles that came out yesterday. And our own report that we produce every year, State of Air Quality Financing, tells us that just 1% of international aid goes to reducing air pollution. 1%. That's compared to the 8 million deaths. And 2% of international public climate finance. Not only that, and this very small amount of money that's tackling the problem, the funding isn't evenly distributed. So African countries are accessing only 5% of that small number, despite having 5 of the most polluted countries in the world by head of population. So we're looking forward to working with development donors and funders to increase the amount of finance available for air quality and also to ensure it's evenly distributed. And so in conclusion, I'm absolutely delighted that there is a health day at the COP for the first time. I'm very keen to see it continue. And what I would say is it's super encouraging to see that for the first time it's being recognised that these negotiations aren't just about reducing carbon emissions. What is being negotiated here is lives. It's an end to asthma attacks. It's fewer lung cancer cases. It's a better quality of life for all of us. So I would encourage everybody to heed the WHO's call for action that we saw on the screen before. A couple of days ago, 5 million health professionals had signed up. I saw this morning it's on 43 million. Phase out fossil fuels, tackle air pollution, and save lives while saving the planet. Thank you.
Amazing. Jane, thank you very much indeed. Julia, Welcome is one of the first philanthropic entities with an explicit focus on climate change and health. So from Welcome's perspective, I get a real sort of sense of what you guys are up to. What priorities do you see for climate action beyond the health sector to protect human health and well-being? And how will Welcome advance the work?
Thank you very much for the question. It's a privilege to be on this panel, and any initiative that involves Helen Clark is obviously going to go well. We all should feel a sense of delight, I think, at being at this Climate and Health Day. It is an overdue recognition that climate change is killing millions. It's meaning billions live lives that are lesser than they could have had, and it's a recognition that we need to act, and act now. You've heard during the course of this morning about all of the intersections we currently know about between climate and health, so I'm not going to restate them. But to come to Welcome's role very specifically, Welcome invests in scientific research, and we are specifically committed to expenditure and research in the area of climate and health. This year alone, we're spending £100 million. And we're doing that because whilst we already know about infectious diseases and extreme heat's effect on biology and the other things that you've heard about this morning, we actually don't have full knowledge yet about the true long-term impacts that climate change, if it continues as it is scheduled to continue at the moment, we don't know all of the implications that will have for human health. So if you think that there is a case for change now, the science that we will be investing in will be building out that case for change even more explicitly. But that doesn't mean that we should be waiting for action. We do know enough now to say that we need to be making the transition from fossil fuels. Obviously, it's got the benefits on air pollution, but it's got the benefits too for climate change mitigation, and that task needs to be addressed. It is an urgent public health intervention. We also know that poor health is a human tragedy, but it's an economic issue. And one of the things I think that dissuades people from acting is maybe they understand the arguments, but when they look at it, there is an upfront cost. And I think we have to acknowledge that is often on the minds of political leaders. But truly analysed with all repercussions, a population that is suffering worse health is a population that is less productive, economies are less strong, and less strong economies are required to bear the burden of increased healthcare costs and increased social care costs. And if we don't understand the intersections of health and economic issues after the COVID pandemic, I really don't know when we're going to understand them. It's manifestly clear. So that too, I think, should reinforce the case for change. Yes, we also know that we need adaptations that we already face. Even if we were able to do all possible mitigation actions tomorrow, climate change is with us now and we need to be adapting to it. And of course, Welcome believes that as we analyse those adaptations, what we need to do to address climate change, we should have health at the centre of that analysis and scientific and evidence-based research that can guide us on the best possible health choices for the future. But let me end where I began. It is just a delight to be here, but I do hope we leave the room not just celebrating the success of having the first ever Climate and Health Day, but bouncing out of here with new energy and new momentum to make sure that this agenda is at the centre of all future global meetings and all future COPs.
Well said. Well said. Thank you very much indeed. I'll let you go. Thank you. Just before what is our last panel, in fact, and we are close to the end of this full session, but just before we start that last panel, I do just want to remind those who have been involved today that there will be a family photo after this panel, after the video, after this panel, so please stay in the room and we'll take just a few minutes to have that photo taken. All right, before our closing video and our closing remarks, I do want to just welcome onto the stage today. It is my honour, in fact, to welcome to the stage two of these stalwarts of climate and health and in the community. Dr. Jenny Miller is the Executive Director of the Global Health and Climate and Health Alliance. Please come and join me. An alliance of organisations representing millions of health professionals around the world working for climate and health solutions. And Dr. Githniji Gitai is the CEO of Amref Health Africa, the largest Africa-based international health development organisation. A round of applause for both. Thank you. Sit down, please. You can stand up. Doctors, where do we go from here?
Well, so, we're at Health Day. I mean, I remember a year ago being in a meeting at the last COP where there was a rumor that there might be a Health Day, and we were talking
Hold on. I'm going to stop you there. Can you make sure the microphones are working for these closing remarks, please? Let's try again. Give it a go.
All right, giving it a go. Are we good?
Can you hear them?
Okay, I think this one is working, is it? Is yours working?
Yes.
Yes.
It's all yours. Floor is yours.
Okay. All right, here we go again. Yeah, I'm really excited to be here. A year ago, there was a rumor.
Oh.
Still no night.
Sit down with each other. Sit down with each other. There you go. And do the thing, but just make sure you use this microphone. So I'm not sure that this is working. Go.
We're at Health Day. Yep. It's amazing to be here. It's been a year of work for many, many people. What do you think? Can you believe it?
Well, I can't believe it, Jenny. 27 COPs later, the real face of climate crisis is woken up, choking, coughing, feverish. I can't believe how self-destructive humanity is, actually. But we must thank the UAE COP28 presidency that saw the light, planned this day, created a multi-stakeholder steering committee to make this day a success. But I also want to recognize the leadership of the World Health Organization that is represented here by DG Tedros because of the long-term leadership in getting where we are. But all those ministers of health who've raised their voice and put their energy to where we are today to ensure that health is truly brought forward as the real face of the climate change. And special mention to my sister, the Minister of Health from Malawi, who has actually given a lot of leadership on this. But let's thank ourselves to Jenny on behalf of all the people who surround us, the people who've been working with us on this journey, including scientists that we represent here, health workers who are represented here, young people like Dr. Omnia and others. I think it's been fantastic to get here. But you've been part of this journey for a long time, Jenny. What does the journey feel like to hear?
You know, just last night I was talking with someone, a colleague that I've known for a long time, who started working on climate change and health 30 years ago. For many, many years, it was a very small community. The thing that's extraordinary is that at this COP, there are literally hundreds of people from the health community at this COP. That's unprecedented. So it's been a long time coming, a long time growing, the movement of the health community that is interested in climate change and working on climate change. And I think for many years, particularly at the COPs, we felt like we were knocking on the doors, sometimes quite literally, like running around and knocking on the doors of different country delegations and bringing the health message and saying, this is important. The climate crisis is a health crisis. This year, it's actually quite amazing to have an official platform for this message for the first time ever. But you've been leading this work across Africa. What has it been like for you to build this work in Africa?
I've seen real convergence of action, actually, passion and social justice rising. I've seen realization by ministers of health, and many of them expressing themselves and saying that actually every climate crisis converges in the health ministry. Every single one of them. When there's flooding, those individuals need care. When there's pneumonia, asthma, those individuals need care. When there are rising cases of cholera, they end up in the Ministry of Health. And therefore, remember also that, unfortunately, some of them die, and the morgues are also part of the health system. So everything we are talking about converges there. But I've seen health ministers rise, and many of them are here, and start to coalesce around a common position. From Kigali, where we had the Africa Health Agenda International Conference, to the World Health Assembly in Geneva, to the Common Africa Position that was hosted by the Minister of Health in Malawi, where ministers of health have converged around this agenda, to the Africa Climate Summit in Nairobi, where we hosted this. And every stop of the way, Jenny, the COP28 presidency has been present in all those meetings that I've mentioned. So this is really the moment, and the ministers of health are saying that the conference of parties, the parties in the conference, are not necessarily ministers of environment. They are the governments, where the ministers of health are actually equal stakeholders. This is what I'm hearing. So, Jenny, the first step is always the hardest. Where do we move on from here?
Yeah, so obviously, Health Day, as lovely and extraordinary as it is, can't be the end. It's got to be the beginning. And I think at this COP, it's vitally important that we carry the focus on health all the way into and through the negotiations. I was really struck on the previous panel, I believe it was Jane who said that what we're negotiating is people's lives. And so in the negotiating rooms that where governments are making the decisions, we need to ensure that health is a focus there too. You know, a number of the earlier panelists and speakers have talked about the importance of phasing out fossil fuels and transitioning and really ramping up equitable access to clean energy. That can start with decisions that are taken in the negotiations this COP. And that's I would see that as a really important point to make progress on. How about you? What do you think is where do you think we need to go from here this COP?
I think we need to realize that we have to bring an end to this self-suicide of fossil fuels to begin with. At the same time, we know that what was a threat, a risk of rising temperatures, global warming, extreme weather events is now a reality today. So we must also adapt communities and make health systems resilient, because cholera is rising, malaria is rising. We can't watch that as people die. So we must also strengthen communities through all the things: health systems, food, water, education, and stable homes. And today, we are seeing that there is going to be a lot of engagement with health ministers all alongside this week, and therefore we look forward to a day where this convening is at every COP, but beyond that, the integration of health in the entire climate agenda.
Thank you. Thank you both. And with that, we will close out the session, but that was absolutely inspiring. I mean, honestly, what a way to close what is the first Health Day, and it certainly will not be the last. It's been an absolute pleasure. I hope that this has been valuable. I know the rest of the day will be too, and I know that the determination is there that this is about saving lives. This is not just about numbers. This is not about percentages anymore or temperatures anymore. You know, this is about saving lives, and I think if we take anything away from this, that is so important. Thank you all for joining us. For those who have been panelists and have been involved in today, please stay while we get the family photo. To the rest of you, thank you and enjoy the rest of your day.